Okay, we're going to talk about one of the most important behaviors that is accessible to you during your time of surgery and rehab and convalescence, and that is walking. So bear with me for a second. The first order of business is to get you off the bed and off your back. One of the things that happens is that sedentariness does not really drive change. In fact, we see quick catabolism. Your body starts to sort of cannibalize protein and lean muscle mass and inactivity. And of course, we need to be immobilized and to rest. But the goal is to get as many little sessions as we can. And for some people, that may be sitting at the edge of the bed and standing and just weight bearing in place. For some people, that may be, hey, I'm immobilized. I'm gonna go ahead and max out my 10,000 steps a day, 12,000 steps a day. And then for some of us, maybe after spine surgery, that's 10 one-minute walks in your house. It doesn't matter where you start or how you're managing this, but we've got to get you walking and loading. So there's a couple reasons for this. One is we need to decongest the system. Hopefully you're doing some whole body wellness, well body exercise, but the movement of walking is really gonna help just circulate the lymph, get the garbage out and bring the groceries in. And part of the plan here is it's one of the easiest ways to get non-threatening input into the body. So I'm not saying you can't go out on your crutches and crutch 100 meters and back. I'm just saying that we want to get as much movement in, and something about the walking in the brain is really important. So it allows our brains to understand, look at all this sort of non-threatening input in the system. And we want to separate that from our training. Oftentimes what happens is that we're still maybe doing some intensive rehab work, but we're not actually accumulating enough non-exercise activity. And so we end up seeing a lot of disruption in sleep and a lot of even feelings of anxiety and things like that, because our normal sort of background workloads are diminished during these times of surgery. So our goal here is to accumulate enough non-exercise activity in the day. That just means functional movement, moving around, being on your feet, so that you actually can accumulate fatigue to fall asleep. Because when we start to see that this axis of I don't move very much, I don't really feel tired, and then I can't sleep, and then we get into kind of a bad pattern here. So first order of business is for you to say, hey, how can I max out my walking? Now, if you've had a lower extremity injury, you may be able to weight bear on it, you may not. Right? You've had a surgery around this. Again, you may be able to have that leg be dependent and down and in gravity for only 20 minutes, even 10 minutes before you need to pop on your back and get the leg up. That's okay. Absolutely okay to get lots of these little sessions in during the day. The worst thing you can do is just absolutely stay in bed all day. Your physical therapist is not going to appreciate that. Your physician's not going to appreciate that. Look, we know that early on, pain management is the real deal. If it's just going back and forth to the bathroom a few times, sitting at the edge of the bed, really making a concerted effort to get up and move. We see changes in your body's ability to handle pressure very quickly, even in just gravity. Blood pressure starts to get wonky. And again, no one ever healed in bed. And our best sort of considerations are to get people moving as much as possible, as much as practicable. So, think, I got 10 one-minute sessions in. Next 2 days, I'm gonna get 12 one-minute sessions in. That's fantastic. Standing at the sink, marching in place, if that's where you're at. If you can get out there and walk and push a prowler, you can drag. Again, you can protect what needs to be protected. But I want you to put walking as the chief activity and almost as important as any other movement or rehab activity you're gonna do.